Hello Habibi. How are you everyone? Welcome to our YK360 YouTube channel. In this video we are going to see some important Saudi Prometric questions and answers. If you are new to the channel, subscribe and don't forget to like the video Habibi.
Question number 1. A nurse is caring for a child with a diagnosis of cystic fibrosis and pneumonia. The plan of care includes nebulizer treatment and chest physiotherapy. The nurse should perform chest physiotherapy. The options are A. Continuously during the nebulizer treatment, B. Prior to the nebulizer treatment, C. After the nebulizer treatment, D. Intermittently during the nebulizer treatment. Answer is option C. After the nebulizer treatment. Question number 2. A patient with a pulmonary embolus and a nursing diagnosis of impaired gas exchange has an order to obtain arterial blood gases. The first intervention by the nurse is to, the options are A. Perform an Allen's test, B. Explain the procedure, C. Gather the equipment, D. Document the procedure. Answer is option C. Gather the equipment. Question number 3. While caring for a patient in the post-anesthesia care unit, PICU, a nurse observes the onset of rapid breathing cyanosis and narrowing blood pressure. The nurse should plan to, the options are A. Administer bolus glucose, B. Suction the airway, C. Turn the patient to the right side, D. Administer intravenous fluids. Answer is option B. Suction the airway. Question number 4. While caring for a patient with ineffective airway clearance related to increased mucus production, the nurse should encourage fluids to, the options are A. Maintain nutrition, B. Prevent boredom, C. Stimulate coughing, D. Thin secretions. Answer is option D. Thin secretions. Question number 5. A patient with advanced lung cancer is exhibiting cyanosis and edema of the head and upper extremities. Which of the following intervention would MOST likely provide an immediate benefit for his patient? The options are A. Place in Trendelenburg position, B. Position on the right side, C. Elevate the head of the bed, D. Elevate extremities. Answer is option C. Elevate the head of the bed. Question number 6. A nurse is administering tuberculin skin tests purified protein derivative, PPD. Which of the following timeframes should the nurse tell the patient to return to the clinic for the test to be read? The options are A. In 12 to 24 hours, B. In 24 to 36 hours, C. In 36 to 48 hours, D. In 48 to 72 hours. Answer is option D. In 48 to 72 hours. Question number 7. A patient who is scheduled for a tonsillectomy is in pre-operative unit. The nurse notes an order for pre-anesthetic medication to be given on call to operation room. The nurse should give this medication. The options are A. Immediately upon being notified to prepare the patient for transport, B. When the operation room staff arrive to transport the patient, C. Only if clearly needed after assessment, D. Upon the patient's arrival in the operation room. Answer is option A. Immediately upon being notified to prepare the patient for transport. Question number 8. Which gauge needle should the nurse use for an intradermal injection on the ventral surface of the forearm for patient with TB? The options are A. 16 gauge needle, B. 20 gauge needle, C. 22 gauge needle, D. 26 gauge needle. Answer is option D. 26 gauge needle. Question number 9. A nurse makes a home visit to a patient recently diagnosed with chronic obstructive pulmonary disease, COPD. Which of the following should the nurse teach the patient about managing COPD? The options are A. Recognizing signs of impending respiratory infection. B. Limiting fluids intake, minimize bronchial secretions. C. Correct technique to auscultate the lung fields. D. Importance of starting antibiotic therapy. Answer is option A. Recognizing signs of impending respiratory infection. Question number 10. A patient with chronic obstructive pulmonary disease, COPD, experiencing frequent dyspnea, which of the following exercise would teach the patient how to better control breathing? The options are A. Lower side rib, B. Segmental, C. Pursed lip, D. Diaphragmatic. Answer is option C. Pursed lip. Question number 11. Patient with asthma is experiencing thick respiratory secretions resulting in increased work of breathing. The best nursing intervention is to, the options are A. Encourage fluids, B. Eliminate dairy products, C. Decrease relative humidity of the room, D. Have the child lay on the left side. Answer is option A. Encourage fluids. Question number 12. What would be the long-term goal for a patient with asthma? The options are A. Quickly reverse airflow obstruction, B. Correct hypoxemia, C. Deliver humidified oxygen via nasal cannula, D. Develop a home and school management plan. Answer is option D. Develop a home and school management plan. Question number 13. A nurse administers an albuterol nebulizer on a patient with asthma exacerbation. Which of following indicates effectiveness of the treatment? The options are A. Adventitious breath sound with cough, B. O2 saturation 94%, C. Nasal flaring, D. Respiration rate 28. Answer is option B. O2 saturation 94%. Question number 14. A patient is diagnosed with asthma exacerbation. Which of the following nursing diagnoses should be the first priority? The options are A. Ineffective airway clearance related to bronchospasm and mucosal edema, B. Fatigue related to hypoxia, C. Anxiety related to illness and loss of control, D. Deficient knowledge related to potential side effect of the medication. Answer is option A. Ineffective airway clearance related to bronchospasm and mucosal edema. Question number 15. An asthmatic patient presents with wheezing and coughing. Oxygen saturation is 88% on room air. Which of the following nursing diagnoses would take priority? The options are A. Imbalanced nutrition related to decreased food intake, B. Activity intolerance related to inefficient breathing, C. Anxiety-related dyspnea and concern of illness, D. Ineffective gas exchange related to bronchospasm. Answer is option D. Ineffective gas exchange related to bronchospasm. Question number 16. A patient presents to the emergency department with complaints of headache, dizziness and confusion. Clinical symptoms include tachypnea and dyspnea with the use of accessory muscles to facilitate breathing. Which of the following orders would the nurse MOST likely implement to reduce the patient's confusion and disorientation? The options are A. Oxygen therapy, B. Chest physical therapy, C. Bronchodilators, D. Hydration fluids. Answer is option A. Oxygen therapy. Question number 17. The nurse is caring for a patient who just had a chest tube inserted due to spontaneous pneumothorax. An appropriate goal is that the patient will, the options are A. Be free of pain within 4 hours, B. Report decreased pain, C. Rest quietly, D. Sleep with few movements. Answer is option B. Report decreased pain and C. Rest quietly. Question number 18. A home health nurse visits a patient with chronic obstructive pulmonary disease, COPD, using home oxygen at 2 liters per minute. The patient reports periods of shortness of breath and inquires about increasing the oxygen to 4 liters per minute. The nurse explains that increasing the supplemental oxygen will. The options are A. Increased activity tolerance. B. Suppress the hypoxic drive. C. Alleviate the shortness of breath. D. Prevent lung infection. Answer is option B. Suppress the hypoxic drive. Question number 19. A patient exhibits clinical manifestation of a pulmonary embolism. Arterial blood gas, ABG, levels and a chest X-ray are ordered. Which of the following test is used to diagnose this condition? The options are A. Computer tomography scan, CT scan. B. Magnetic resonance imaging, MRI. C. Pulmonary angiography. D. Pulmonary function test. Answer is option C. Pulmonary angiography. Question number 20. A nurse is caring for a child who is post-tonsillectomy and adenoidectomy. The nurse should plan to assess which of the following complications? The options are A. Pulmonary hypertension. B. Hemorrhage. C. Hearing loss. Answer is option B. Hemorrhage. Question number 21. A nurse caring for a patient with acute pulmonary edema observes that the patient's cough produces white, frothy and that the patient is extremely dyspneic. The patient has inspiratory and expiratory wheezing on auscultation of the lungs. The immediate objective of treatment is to. The options are A. Improve oxygenation. B. Decrease anxiety. C. Improve tissue perfusion. D. Decrease risk for aspiration. Answer is option A. Improve oxygenation. Question number 22. While performing an assessment on a post-surgical patient 2 days after surgery, the nurse notes shallow and rapid respirations. What should the nurse do next? The options are A. Assess the patient from pain. B. Obtain an order from supplemental oxygen. C. Elevate the head of the bed. D. Place a warm blanket on the patient. Answer is option C. Elevate the head of the bed. Question number 23. The nurse is caring for a child admitted with viral pneumonia. Which of the following nursing diagnoses should receive priority? The options are A. Nutrition altered, less than body requirements. B. Ineffective airway clearance. C. Fluid volume deficit. D. Risk for injury. Answer is option B. Ineffective airway clearance. Question number 24. The nurse receives an order to obtain an arterial blood gas, ABG, specimen on a patient. The nurse will use the radial artery to obtain the specimen. Which of the following will the nurse assess before puncturing the radial artery? The options are A. Allen test. B. Partial pressure of arterial oxygen. C. Partial carbon dioxide. D. Prothrombin time. Answer is option A. Allen test. Question number 25. A patient with pneumonia has a temperature 40 Celsius, 104 Fahrenheit. Heart rate 20. Respiratory rate 32 and dyspnea. Patient has an ineffective airway clearance related to excessive tracheobronchial secretions. Which of the following interventions would the nurse implement to enhance the patient's airway clearance? The options are A. Administer oxygen as ordered. B. Maintain a comfortable position. C. Increase fluid intake. D. Administer prescribed analgesic. Answer is option C. Increase fluid intake.
Yalla Habibi, you still not subscribe? Subscribe to our channel. If you need full questions bank PDF, contact us at www.saudimaru.com or contact our WhatsApp number Thanks for watching.